Welcome to the Broker Bootcamp Podcast. Real conversations and training by agents for agents. Let's grow together.
Well, hi, everybody, and welcome to this episode of the Broker Bootcamp Podcast. We've been gone for a little while, but it's time to get back on track with having regular episodes talking about important things that are happening in the Medicare space. Today's episode, we're going to dive into some headlines that have come out here in the last week or so. And what we're looking at is at Stats Breakthrough Summit, held on March 19th, 2026 in New York City, one of CMS's leaders, Chris Klomp, openly was discussing whether default enrollment into Medicare Advantage rather than defaulting beneficiaries into fee-for-service or original Medicare was maybe a way to go, maybe a good idea. And this is not the first time that this has been talked about. We heard about this back in January and other times here in the last 6 to 12 months. But this time was a little bit different. The topic really took off quickly on social media. And we even saw some healthcare news outlets with headlines like these. I love the headlines. They're always pretty comical. Headline number one, we have CMS is weighing Medicare Advantage as recipient's default enrollment path. Let's read that one more time. CMS is weighing Medicare Advantage as recipient's default enrollment path. Number two, Health Policy Roundup, Medicare Director mulls automatic MA enrollment. Number three, CMS considering automatic enrollment in a Medicare Advantage plan. The idea is part of the conservative Project 2025 policy. Now, I did look into that, and there is recommendations in Project 2025 to indeed make Medicare enrollment always go towards Medicare Advantage. Now, there's a key provision to that we're going to get to here in a moment. Let's look at headline number four. It might be my favorite. Trump could saddle seniors with a costly Medicare Advantage plan, whether they like it or not. Super dramatic, super political, just like the climate that we find ourselves living in right now. So what is all this buzz about? What's the hyperbole all about? Why is everybody so quick to jump on to these talking points and to provide all of this commentary? And really, what important details are we missing when we read these headlines? Well, there's a really big one, as you can imagine. So whenever these kind of news talking points come out, there are headlines that want to get people to come in and read whatever it is that these news outlets are positing. But there's a really, really, really important piece that you won't find in the headlines. And in fact, if you look at many of these stories, you're not going to see this in the stories themselves, which is even more problematic. So here's the piece that they're leaving out. It is important to distinguish that this provision pertains, and I would add this disclaimer, at least for now, to seniors who do not make a choice. So let's go back up to these headlines for a second here. They sound incredibly problematic, right? Trump could saddle seniors with a costly Medicare Advantage plan, which could potentially be true if, in fact, they got this policy implemented. But what they're talking about here are seniors who do not make a choice. That is a very, very, very important thing to understand. We're not talking about every single Medicare beneficiary here. We're talking about those people who turn 65, get Medicare Part A and Part B, but take no additional steps to sign up for a Medicare supplement plan and or a Medicare Advantage plan. So rather than just leave those Part A and B only recipients having that fee-for-service model of original Medicare, what we're actually talking about here is getting them automatically enrolled into a Medicare Advantage plan. And while hearing Chris Klomp, talk about this in these open sessions is a little alarming, just like everything else in this season of a lot of change, almost constant change. It's almost hard to keep up with it as brokers and for our clients, as we all know. I would be paying even more attention to what's happening in Congress. So there was a bill introduced HR 3467, and I really paid attention to this much more so than these comments that people are sharing across the internet from things like summits. This bill would, in part, as you know, bills in Congress have a lot of things packed into them. You've heard the word pork. But it would, in part, change the default enrollment to MA, so Medicare Advantage. And again, that's going to be for these beneficiaries who fail to make a choice. It would indeed provide an opportunity to opt out. What that looks like, we don't know. And as you have seen, like with the Inflation Reduction Act, when bills are put into place and then they're passed into law, there's a lot of work to be done on the administrative side to clarify exactly how these things are going to play out in reality. Now, here's probably the more concerning provision that I see in HR 3467. It would mandate that once people are enrolled in an MA plan, they would be unable to disenroll or switch plans for 3 years. Now, friends, I find that part heavily problematic, both for the clientele that we serve, right? Senior retiree population, and for us in the broker channel. As we look at a lot of this that's, being played out online right now, these headlines indicate that the sky is falling, that here comes the government with another change, and now they're going to automatically enroll everybody in Medicare Advantage plans. That is not at all what we're talking about here. What we're talking about here is, again, those individuals who only choose original Medicare Part A and Part B and no additional insurance. As we know from being agents, that is really problematic, right? You know the Medicare Part A cost. You know that they have a 20% liability on Medicare Part B after they meet whatever their deductible is for that year. And we know that both Part A and Part B, as they stand alone, have no out-of-pocket limit. And so as late or as recently as 2023, there was a data study done where we know that approximately 3.5 million Medicare beneficiaries in traditional Medicare. So there are 3.5 million, at least in 2023, individuals who only have original Medicare. And for the most part, as brokers, these are people who we are not actively involved with, at least initially. So they make a choice. They say, hey, I'm paying enough for my Part B premium. I'm only going to sign up for original Medicare, and I'm going to risk potentially having higher costs and very large out-of-pockets. And that's just the way it's going to be. So we know that there's people like that. And when we typically run into them is when they have a problem, when they have a Part B drug that they're given, and their cost is now 20%, and they're paying thousands upon thousands of dollars for that medication. Or they need chemotherapy or radiation or some other high-cost item that they're paying 20% on. So that Part B 20% can really push some of this 3.5 million who've decidedly made the choice to not have additional coverage into our doors or into our call centers. The other way that we run into these individuals might be multiple hospitalizations. They keep going in and out of the hospital. So Part A is getting more and more and more expensive for them. And or a family member or friend or provider convinces them, hey, it is high time for you to get additional coverage. You have a lot of liability here because of the fact that you're only on original Medicare. So with that, there is a component to this that we do indeed play part in. This 3.5 million people who fails to make that additional coverage choice is somebody that we can continue to market to and engage with. We run into them at events. We run into them at grassroots marketing things that we do in the community, and they come to us, but certainly not in terms of the same caliber of numbers that we get for people turning 65 or people that we're working with who are leaving employer coverage through some other vehicle or relationship that we've established. So look at the bigger picture. Look at the taxpayer-funded Medicare program and the fact that, this was 2023 numbers. What is it today? Is it higher or lower than 3.5 million? But these individuals, their lack of supplemental coverage, it does indeed both leave them vulnerable and exposed to significant potential for financial risk, but it also in turn can put a high high demand on the system by way of things that we know are going to happen for at least a large percentage of people, which would be defaulting on bills and perhaps bankruptcy court. So that is a consideration. When you look at the headlines here and you contemplate the issue a little bit more thoroughly, we can see that there might be a problem, right? If we have 3.5 million people only on Part A and Part B, it would be advantageous to them and to the Medicare program for them to pursue and secure additional coverage. So one thing I would say for us as brokers is maybe instead of worrying about the headlines, right? Because there's going to be many. We know the final rule will be coming out here in the next month or two. We're going to continue to see political talking points. Medicare is one of those big programs that we have in our country. It's an entitlement program. So both parties love to use it as a political football. It's going to be in the news. But in this very instance, maybe instead of worrying about what they're talking about right now, we're definitely going to continue to pay attention to it. But how may we, as brokers, be able to maybe support the direction that the government is considering taking with these underinsured seniors, because they truly are that, underinsured seniors. So think about that and, maybe brainstorm that with your team, brainstorm that in the area of the country where you work as a broker. How might we be able to assist in the event that the government, either by way of an act of Congress or something that CMS puts into place through administrative guidelines, what can we potentially do? So one consideration would be maybe we recommend that they implement something like the Help on Demand system that they've created for the Affordable Care Act. By no means am I endorsing that as an incredible platform. I've worked on it myself. Many of the people that we get through that referral source end up not being viable prospects. Many of you have experienced that too. The reason I'm giving you that as an example is if the government is going to, in fact, truly considering an automatic enrollment for those people that don't make a choice, rather than rallying against that, let's rally at least to be involved in it in some way, shape, or form. We are the ultimate resource for beneficiaries. We help them make informed choices. And so if this program is going to be rolled out, to me, that's paramount. How can we be involved? And so let's stay on top of this issue, and let's start to communicate with our lawmakers directly through our organizations and associations about how we can potentially be involved in the solution, not just sit back and complain about what it is that they're talking about doing. I think that's fundamentally important. So this is one example of an emerging issue, an emerging topic that you see what we did here in the last 13 or 14 minutes. We took a look at the headlines, and then we quickly figured out that behind the headlines, there were some problems. The headlines were largely misleading. They failed in their very wording to include the fact that this pertained to a somewhat narrow portion of the senior population, while insinuating instead that this change was a wholesale automatic enrollment for Medicare beneficiaries into MA plans. That is not at all what's really taking place here. And that's going to happen again and again and again in the next few months and really over the next few years. And that's what's been happening for the last several years. And it's because the industry that we work in is being heavily scrutinized. And as long as it is, everybody that puts out media is going to do everything that they can to get attention. This is why we have to stay well informed. So hopefully the Broker Bootcamp podcast can be just that for you, a place to come, and we will break down the issues, and we will break down the specifics of the issue, and we will break down the headlines to find out what's really going on and what the truth of the matter is. That will enable you and us to be really informed, really educated, and really equipped to do what many of us already do, and some of our organizations do really well, which is advocate both for our industry and, more importantly, for the clients that we serve as brokers. So that's what we're going to do. In addition, we are going to be doing a lot of teaching and training through our podcast episodes. So I encourage you to come back for those. We're going to do simple things again like we did when we first started this podcast many years ago. We're going to go deep into what Part A is, what Part B is, and have really good conversations around all of the components of Medicare and try to give a little more depth and detail than we typically get through things like the AHIP or the carrier certification. And as always, our goal is to make it really broker-centric and broker-friendly. We want you to feel informed, educated, and empowered by the things that we talk about here at the Broker Bootcamp podcast. So if you don't already like, follow, and subscribe, I invite you to do so. And just know we're going to be back with more episodes just like this to bring you the latest and greatest news and hopefully to continue to help you do what we so desire to help you do, which is grow your business. For now, that's all. We're going to sign off. Hope to see you on the next episode.